find yourself in a situation where you are not sure how you're going to pay your rent or how you're going to put food on the table, you are not thinking about going to get your annual checkup. You are not thinking about going to get, have somebody check on your blood pressure. You don't even know that that's something that's an issue.
So many of the people that come here are, at its worst, I suppose, facing decisions about purchasing their medications instead of purchasing food or vice versa. But they're also dealing with chronic illnesses, high blood pressure, diabetes, or may not even know about those things.
So I started the mobile health clinic as a response to an identification of lack of services for people who were coming to two organizations. So Dorcas Ministries and Western Wake Crisis Ministry are both amazing organizations in the Cary Apex community, but they didn't have anything related to healthcare. So when the clinic started, the one organization, Western Wake Crisis Ministry, said, we love the idea of having some nurses here to help our folks, but we don't have space. And it would be great if you could bring a mobile unit to us and park out front. And as people are coming in to use the food pantry, they could also then see you on those days. So that was how the clinic started, is in a small box truck, and then we eventually grew into a 36-foot RV.
In 2020, during COVID, things started to shut down in terms of the clinic and everything. And so a lot of our 484 public health undergraduate students were coming out and helping with the screenings, and then once we were able to offer vaccines to these vulnerable populations. And when we started thinking about clinical expansion, I applied for a grant with AHEC, and we were able to expand into Chatham County. We totally believe that health is a right and that everybody deserves access to good health and to health promotion. We feel that we are serving people that oftentimes are vulnerable populations, oftentimes low income, and oftentimes uninsured or underinsured.
Our healthcare system is not the easiest to navigate. So that's another barrier, layered upon barrier after barrier after barrier. So having somebody who's going to spend the time with you that is needed to help you, that doesn't mean that they do everything for you or with you, but making sure that you have a place to start, you have somebody who's going to point you in the right direction. They're going to do a lot of things for you and help you navigate that complicated system.
When the nurses started coming here, I was wary about whether or not our neighbors would be accepting and whether or not they would trust the nurses to assist them, because trust takes such a long time to build. But at this point, people notice when the nurses aren't here. They ask where they are. They ask when they'll be back. They appreciate the youth and the enthusiasm and the intelligence and care that they bring to the program. I think the fact that several of the students speak Spanish has really helped build trust between the nursing program and the people that we serve. So I think overall they've been really well received and accepted as a part of Cora.
So I'm definitely learning a lot here with public health and patient care, and making sure that we kind of meet in between. And we may think that a patient may not really so much care about their health, but I don't think it's necessarily that. I know most places offer interpretation services, but sometimes I think that what they say or the message they're trying to say doesn't come across, so there's cultural differences or structural barriers. A veces yo sé que es difícil encontrar un doctor o dónde ir donde no sea muy costoso, y siento que esta clínica te puede ayudar mucho con eso, incluso ayudarte a entender un poquito más de cómo está tu salud en este momento.
And that's what the mobile health clinic does. It takes those resources, and I can't tell you how many times in healthcare you get told no. Everything here's yeses. If we don't have that resource, we're going to find it for you. We learn as nurses, be patient-centered and be focused, but no one ever really teaches you those steps and why it's important. So like the mobile health clinic helps you kind of see what social determinants of health means. It helps you see this isn't just a concept you're being taught in a school. You're taking people and making small changes to completely change the trajectory of their health and of their life.
The clinic helped me medically because all my life, and even during my 21 years in the military, I always was dieting. Clinic helped me do a lifestyle change. This lifestyle change helped me go from 195 pounds to 150 pounds. But I cry when I think about the clinic. I cry that people don't take advantage of it because I don't know if I would be able to walk through New York with my daughter because she lives there now. So the program just is so important, and I just wish they continue the program. I want the nurses of this program to know that they are pivotal to the health of this community, and I just want them to continue doing what they're doing, because if even just save one person like me, and I'm able to give this to other people, what they did is not just me, it's being carried on.
So for the next 10 years, the UNC School of Nursing Mobile Health Clinic will continue to serve the folks in the community, and I want the folks in the community to know that all are welcome, that there are no exceptions to who can come into our space and who can receive the services that they need to thrive and to be healthy and to live their best lives.